I know that your area of expertise happens to be multiples. Can you give our viewers who are actually carrying twins a little bit of advice? Because we've kind of just been talking about a single pregnancy for the most part. But so what's the rule of thumb if you're carrying twins? You double up or?
Well, not necessarily. Everything I've said goes for twins and as well as for triplets and quads. So protein is even more important. The drain of omega-3 fatty acids is much more. Preterm labor is much more frequent, so that rest and good growth. Women with curves do much better with twins. Taller women do better because there's literally more room for those children to grow.
Preterm is not a good thing, but what can we do to prevent it?
One of the first things you can do is hydration, having enough water. Matter of fact, if you go into preterm labor and you go to the hospital, the very first thing the hospital staff's going to ask you to do is drink water. If you can't drink it, they'll start an IV.
Okay.
But if you are well hydrated, if you get into the water habit, not only will it prevent preterm labor for the most part, but you'll think better, your skin will be clearer, you are less likely to get urinary tract infections. There's just a lot of benefits to drinking water, and that's one of the things that women don't drink enough of. The other is, we mentioned before, omega-3 fatty acids are very therapeutic for preventing preterm labor.
Now, so the water and the omega-3s and protein for preterm labor, even if you're genetically predisposed to maybe having it, or if your first pregnancy was preterm.
Exactly.
These are the things to help prevent.
These are proactive preventive measures.
Dr. Duke, I could talk to you for hours about this, but time is of the essence. But we have had a few questions come in from our viewers as we were speaking, funnily enough. So I'm going to get onto those now. Alicia from Basking Ridge in New Jersey, she writes, I know how important it is to eat healthy, but I've been nauseous morning, noon and night since I found out I was pregnant 4 months ago. I'm lucky if I can even keep toast and soup down. Will my baby's growth suffer as a result of this?
Unfortunately, yes. So the response to that would be to ask your obstetrician, tell him that you are extremely nauseated, that you can't keep foods down, and ask for an antiemetic. And take it religiously.
And so that's something that will prevent the nausea.
Exactly.
Okay, and they're okay to take?
Yes.
Right. Leslie from Santa Monica says, my doctor gave me a prescription for prenatal vitamins. They're like horse pills and make me feel sick to my stomach. If I'm eating healthy, do I still need to take a multivitamin every day? Good question.
This is a common complaint. I don't like prenatal vitamins. It's a typical example of consumer marketing. You're standing there in the grocery store or the supermarket, and you're looking at 2 bottles of vitamins, and one is 200%, 300%, the other is 400%. There's a tendency to overdo, and that's part of what's making her nauseated is these vitamins she's taking probably have too high a level. The other problem is that they typically combine vitamins and minerals in one pill, and minerals will bind to everything. So they're lowering the bioavailability, the availability of those vitamins to actually be absorbed and be used.
Which is the point.
Exactly. So they're making her nauseated, which is counteracting the whole purpose of eating during pregnancy. And she's probably not going to take them. Better to take, if you are going to take a vitamin, to take something that has only 100% of the RDA for pregnancy or even non-pregnant, and only of vitamins.
Yeah.
And the one I like is actually one a day essentials, if you can find them. They're very tiny pills. All they have is 100% of the RDA, non-pregnant RDA.
Trish from Lansing, Michigan says, when it comes to fruits and vegetables, which one do you consider superstars?
Well, funny she should ask this question, because I have on my website, which is drbarbaraluke.com, my top 25 food all-stars, which are the best foods I think you should eat. Because I get asked this question a lot.
I'm sure.
So let me give you my list of fruits and vegetables that I think are the best. Asparagus, broccoli,
yes.
cabbage, pumpkin, spinach, sweet potatoes and yams, and tomatoes. Just think color.
Yeah.
Anything with a really dark, rich color is going to have more nutrients, more nutrient dense. Fruits, apples, any kind of apples. My favorite are Pink Lady
Me too.
apples. They're nice and sweet, but they've got lots of fiber, so you're not going to get that spike in blood sugar level. Avocados, one of the healthiest fruits you can eat. Cherries, we've mentioned cherries lots of times. Just don't sit there and eat a pound at a time. And oranges.
Okay, yeah.
Now, oranges, this is a habit I've had for many years. I have 2 oranges at night. Oranges are very high fiber. So although they're sweet, the fiber keeps that blood sugar from being absorbed too quickly and your blood sugar rising too quickly.
I craved oranges when in that first few weeks. Craved them. Like anything orange.
Listening to your appetite, eating to appetite, cluing into the cues that your body is giving you. Most women crave proteins when they're pregnant. They crave milk and dairy products. Suddenly milk tastes good. They've never had a glass since they're 12 years
a glass
old.
of milk.
Right, and fruits and vegetables. And your taste, your sense of smell, your sense of taste becomes much more acute when you are pregnant. Food tastes better. It's also absorbed slower when you're pregnant. In an attempt, nature is doing this to get more out of the food that you're eating.
Last question is from Amy, who lives in Texas. I'm planning to breastfeed. Is there a food that I should be eating in my 3rd trimester to help make my breast milk more nutritious?
Well, not only 3rd trimester, but when she is breastfeeding. The protein, fat, and carbohydrate in breast milk is amazingly constant no matter what you eat. But the type of fat that's in breast milk reflects what you're eating. And that's where the omega-3s, again, come in very important. So there are 3 things you can alter your breast milk: omega-3 fatty acids, zinc, and iodine. So seafood actually matches for both of those, the omega-3 fatty acids and iodine, very rich in seafood. And zinc is dairy products, fortified bread.
Eggs, is there zinc in eggs?
Eggs, yogurt, beef, chicken.
Well, you've just given us so much advice, and if you are pregnant out there, get on to drbarbaraluke.com to get all of the, if there's anything that we've missed. But it's the omega-3s, the fish for the protein and the omega-3s.
Right.
Good carbohydrates.
Lots of water.
Lots of water.
Eat often.
Eating a little bit more often, but smaller volumes of food.
And rest.
Dr. Luke, thank you so much for coming on. We'll see you next time on Real Savvy Moms. Thanks for joining us.